So imagine that you're in your office lunch break room and you're just grabbing yourself a little bit of a snack. And all of a sudden, from the other person who's in the room, you hear coughing and nose blowing and sneezing, and you're thinking to yourself, oh, does this person have COVID? Am I gonna get sick? And I think the reality is a lot of those patients that we think of as having COVID or some sort of a virus probably are suffering from chronic sinusitis or bacterial sinus infections, or even a combination of that and allergies, which is causing their symptoms. Sure, it could be COVID or it could be a virus, but most likely it's something else. And I think those are patients that if they're chronically coughing and having these symptoms on a regular basis, not just that particular day, probably be worthwhile going and seeing a specialist and figuring out if they have some underlying really treatable chronic sinus conditions that if you could improve could make them feel better and avoid everybody feeling awkward in the lunchroom.